And I thank the gentleman, and I would now recognize Ms. Chu for 5 minutes.
Mr. Chair, I'm outraged by the sensational nature of this hearing that makes no pretense of being fair or impartial. And I'm outraged by the accusations made against an organization that serves millions of women in our country. In fact, 1 in 5 American women visit a Planned Parenthood center for health care at some point in their lives. For some, it's the only place that they can turn to for even the most basic of care. When our economy fell into tough times a few years ago, women, especially low-income women, turned to Planned Parenthood for affordable and dependable primary care services. They fill a vital gap that community health centers can't fill by themselves. The local affiliate in my district, Planned Parenthood Pasadena in San Gabriel Valley, was one of the targets of these videos. The Center for Medical Progress tried to discredit them with their heavily edited videos. These 5 short videos, the ones that have been released by CMP, have at least 47 splices where content is edited out, but the conversation appears to be seamless. Critical context is omitted, including Planned Parenthood staff members repeatedly saying that there is no profit from tissue donation and should not be, that tissue donation programs must follow the law, and that substantial changes to medical procedures would not occur. And we know from the longer version of the first video that Dr. Nakatola said at least 10 times that Planned Parenthood affiliates do not profit from fetal tissue donation, making statements such as, affiliates are not looking to make money by doing this. They're looking to serve their patients and just make it not impact their bottom line. Yet none of the highly relevant and exculpatory passages were included in the edited versions excerpts that CMP initially released to the national media. And yet, my 4 affiliates in my local area served over 27,000 women last year alone and saw over 51,500 patients. They did thousands of well woman exams, breast exams, tests to determine sexually transmitted diseases, and cervical cancer screenings. By doing this, they saved lives. The leading questions in these videos don't lead to these numbers. Instead, the questions lead to a discussion about a legal fetal tissue donation program that affiliates don't even participate in for the most part. And so, along with my constituents, I'm calling out these videos for what they are, the latest attacks on women's access to reproductive health care. Now, Republicans are saying that we don't want to see the videos, but the truth is the opposite. We want to see the whole video, not a selectively edited version. And in fact, that is why I, along with 11 of my colleagues, sent a letter to Chairman Goodlatte today saying that the full footage must be made available to us and the public. Only then can there be a fair and complete investigation. And in fact, without the full unedited source footage, it is impossible for there to be a thorough and transparent congressional investigation. And so, Professor Smith,
yes.
If videos like these have any evidentiary value? In other words, should we rely on these videos in our own investigations? And do you believe that the public would benefit from CMP releasing the full footage?
Absolutely. I think CMP should be required to release the full footage. The edited versions would not have evidentiary value precisely for the reasons you've stated, because taken out of context and placed over each other out of time, the way sometimes world leaders are made to appear to be singing pop songs, it's that kind of technique that's used on the internet quite often, and it's used here in these videos, and it's just as unreliable.
And Professor Smith, you talked about that research panel that determined the ethics of fetal tissue donation, that 21 people were appointed to this commission and supported the idea of fetal research. Can you speak about some of the safeguards that the commission and lawmakers put in place to ensure no wrongdoing? And do you believe these safeguards are working?
Yes, I do. As far as I can tell, the safeguards appear to be working. That fetal tissue is not allowed to be sold. Women are consented to the abortion separately from the consent to donate tissue. So the incentives for the main actors in these situations are not, it's not pushing abortion in any way, it's not manipulating people or coercing their choice, and those are all the things and factors that I would hope would be in place. To the extent the committee continues to have concerns about that and the public continues to have concerns about whether this is being implemented properly, I think the appropriate response is another commission to address the issues and to investigate the issue.
Thank you. Mr. Chair, I would like to enter into the record 2 letters. The first is a letter from 11 Latino organizations in support of Planned Parenthood of America. The second is a letter from Planned Parenthood to the National Institutes of Health on fetal tissue donation and medical research.
Without objection.